we wouldn't be able to hit these same angles and really find our spots under the muscle inside of those cavities like we kind of are right here with Dr. Nick. Now we'd be able to, you know, kind of hit this little bit of our anterior shoulder head, but we would never be able to get right here. Hey everybody, this is Mike. I've got Dr. Nick with me. We're here at Kalkstein Chiropractic, your local Towson, Baltimore area chiropractor. Back at it again with another focused Shockwave, our newest tool in the office. And today we're going to have some fun with Dr. Nick. So Dr. Nick's been having some shoulder pain, primarily right here in the front cuff of his shoulder. Really experiences a lot of discomfort when he's lifting his arm. So
push-ups seem to be the worst as well. For push-up, I get it probably a little higher up there. But yeah, it's not, when it's talking to me, it's not fun. So
we're going to go ahead and give him a little bit of focused shockwave treatment, not only to help himself with his own recovery, but also so he can properly assist his own patients as well. So without further ado, let's get started. So I was telling Dr. Nick the focused shockwave is a much more precise sound wave. So now when we're dealing with it, we'll not get a whole lot of reaction until we've really found our spot that we're looking for. And you can see we've found that good spot for Dr. Nick. So we're just going to play with the angle a little bit. But Dr. Nick, what does it feel like for everybody? What are you feeling right now?
Gosh, wow, that's a good question. So it's like that right there is perfect. Whew. It's like a deep achiness, but you don't feel the slapping like you do with the radial pulse, right? Like when you find this spot, like it lets you know, and then it kind of like, it starts to expand out. Yeah, nothing over there, but right there actually is, ooh, wow. It's so weird. It's like occasionally I'll feel like the flinch of the muscle when you hit a good trigger point, but when you hit that tender spot, it is just like...
It lets you know it's there, huh?
A wave of achiness.
And so what's really cool about the focused shockwave, you have to imagine this is going about 5 inches into our area, our targeted area, wherever this head is. So this is a shockwave that we wouldn't be able to do with the radial pulse. If we stuck the radial pulse right here, we would immediately be going into that bone. We wouldn't be able to hit these same angles and really find our spots under the muscle inside of those cavities like we kind of are right here with Dr. Nick. Now we'd be able to, you know, kind of hit this little bit of our anterior shoulder head, but we would never be able to get right here. Never would be able to do it with the radial pulse. So that's the reason why, you know, our office has gotten this, is so we can really treat a number of tendinopathies, a number of problems that we weren't able to do before. And what's actually really cool is you even get some really good research on the focused shockwave with bone fractures. And again, that's something that you cannot treat with the radial pulse shockwave. So just like the rehabilitative industry, the sports industry is ever changing, so are the practices in our office and the tools that we incorporate with that practice. So this is just another one of the additions our office is doing to not only treat a more broader variety of problems, but also to really dial in on things that we were doing before, but just not as effectively as we can with our new toy. So, like I said earlier, this is Mike, got Dr. Nick here. We'll see you guys sometime for an adjustment down at Kalkstein Chiropractic.
Guys, if you saw my Shockwave video, no you didn't.